had
Good.
a great day at work.
Yeah, we are
So
doing
this
fine.
evening, this evening we've gathered to share on a very important topic on the wrong use of medications. But before we start, let's share a word of prayer. Try. Okay, so Father Lord, we thank you so much for this evening. We thank you for your grace, your mercies, abundance upon us, and for bringing us together to share on this important topic. Father, we ask for wisdom. We ask that help us to gain the necessary knowledge that we need when it comes to the use of medication so that we can make better informed choices when it comes to our health. In the mighty name of Jesus, have we prayed with thanksgiving. Amen.
Amen.
Please, can we all see the screen?
Is
Please, can we
yes.
see? Okay, great. So, wrong use of medications. This will be the outline for the presentation. We'll first of all talk about how medications are used rightly, the rational use of medicine first. Then we will now learn about the wrong use. So once we know that how it is rightly used, anything in contrast to it, we know that that is the wrong use. Then we'll look at some examples, some scenarios that we find ourselves using medications wrongly, and then the consequence, the effects of what happens when we do that. Then finally, we'll look at some safe practices that we can engage in to ensure that we are using our medications rightly. And then we'll conclude on that. So it will be a very brief presentation. I'll try and use very simple expressions so that we can all understand. Okay, so please let's start. So first of all, what is the right use of medication? How do we use our medications rightly? So the WHO has given us a very standard criteria as a guide when it comes to the right use of our medications. So the first one, it has to be for the right patient. Is this medications for you? It's supposed to be solely for you and nobody else. And then the drug, the right drug, if it's paracetamol that you've been prescribed for, it's paracetamol and nothing else. And then the dose, how have you been instructed to take it? Just one tablet a day or twice a day? And it's just that you are following just that. So the right dose. And then the timing. What did the doctor tell you? What did the pharmacist tell you? Take it at night, take it before or after meals, and you are doing just that. And then the route. Are you supposed to insert it as a suppository in the anal region? Or you're supposed to take it by mouth or even apply it on the skin? So these are the very 5 rights that you follow whenever you are using medications rightly. First, right patient, right drug, right dose, right time, and then the right route of administration. So once you follow all these things, you know that you are using your medications rightly. Now, anything in contrast to this means that you are using your medications wrongly. So under the wrong use of medications, I group them under 2 main subheadings. It's either you are misusing it or you are abusing it. So under misusing, it means that you are taking the medication in a way other than it was prescribed. So either you are taking more than was prescribed for you. So you have pain. The doctor has prescribed for you a pain reliever. He tells you to take a 1 tablet, and you say, oh, the doctor doesn't know the intensity of pain I'm going through, so let me take 2 instead of the 1. You are misusing it. Okay. And then when it comes to the abuse, it has to do with the intent. So this medication is meant to relieve pain, but you are taking it for another thing else. So mostly for the recreational purposes. When you say recreational purposes, it means that you want to alter your state of consciousness. So for instance, students, they want to stay alert and be able to study throughout the night. So they will take a stimulant, a medication that will help them to do that. So they are abusing it. Recently, we saw in the news, Unim Red. It's a pain reliever, but people are taking it to get high, for the euphoria, to hallucinate and all that. So in that case, you say you are abusing it. And that is a wrong use of the medicine. So I think the foundation has been set right. Now we know what we mean when you say you are using medication rightly. It means that it's for the right patient, it's the right drug for me, it's the right dose, I'm taking it at the right time, and I'm taking it via the right route. If I'm using it wrongly, it's either I'm taking it in a way other than it was prescribed. Either I'm taking too many, I'm taking it for too long a duration, or even a shorter duration. In that case, I'm misusing it. If I'm abusing it, then I'm taking it for a different intent. I'm taking it to get high, for the euphoria, to hallucinate, and all that. So this is the foundation. I mean, this is the basis. Right use and then wrong use. Now let's look at some scenarios where we find ourselves using medications wrongly. So the first one, self-medication. So when you say self-medication, basically what it means is that you are using the medication unguided by a physician or a healthcare professional. So you are using the medication based on your own instinct or your own, decisions. And so you're not feeling well or you're having pain and say, let me go and get some Panadol, or you have some Panadol already in the house, then you take it. You're self-medicating because of that pain you are having. If a doctor should comprehensively assess you, maybe it's not Panadol that you are going to be given. And so you have decided to take it upon yourself and take Panadol. So you're self-medicating. And then sharing medicines. We said from the beginning, the right use of medicine, it has to be for the right patient, only for you. You don't have to share. So you go to the hospital, they prescribe a drug for you. You come home and maybe your spouse is also having, some of the symptoms that you presented at the hospital. So you said, oh, it's like you're also having the same infection I'm having. Let's share. Then you give some to your spouse. Mind you, there are lots of ailments that present with similar symptoms. So the fact that your spouse is having symptoms as you also presented does not necessarily mean that it's suffering from the same condition. So if you share your medications, you are using your medications wrongly. Incomplete doses, especially when it comes to the anti-malarials and then the antibiotics, where the duration of therapy is very important. So your anti-malarial, to take it for 3 days. You take it for first day, second day, you're fine. The fever is gone, the rigors, the chills, everything, headache is gone. And you say to yourself, oh, I'm fine. So you don't take for the last day. That's an incomplete dose. You are using your medication wrongly. Antibiotics, similarly. They told you, they instructed you, take it for 5 days or 7 days. You take it for 1, 2 days, every symptom has disappeared. So it's time to stop. And we will soon see in the other slides, the latter slides, the consequences of some of these actions, the resistance and all that we are breeding now. Now let's move to the fourth point, overdosing and underdosing. So overdosing, very common when it comes to pain. Take 1 tablet, she will take 2 because it feels like using an intense pain, forgetting that you might be having other conditions. That is why the doctor says you should just take 1. Okay. And then the underdosing. If you've seen the medications that we give for those who have TB and then HIV, they are very huge in sizes. So when the doctor says you take 4 of those tablets, in fact, it is very discouraging. So you'll be tempted to just take 2 or 3. You're underdosing because that's not the right amount the doctor says you should take. And when you do that, it also has its own repercussions. You reduce the efficacy of the drug. The drug is not going to act as it's supposed to do. And that is a wrong use of your medication. Mixing it with alcohol and herbal preparations. Alcohol in itself has its own detrimental effect on the body. Okay, if you mix it with other medication, you reduce the efficacy of the drug. For instance, this common drug, metronidazole, what we commonly call flagell. Okay, if you take it with alcohol, it gives a very undesirable effect. You get lots of nausea, vomiting, hot flashes, palpitations, a whole lot. So if you do that, you are using your medications wrongly. If you combine it with other herbal preparation, you are using it because you always have to seek consent either from your doctor or your pharmacist. You have some herbal preparation at home that you are taking, and you've been prescribed another drug. Always, seek consent. Can I take it together, or I shouldn't take it? If you do that without any consent, that is a wrong use of your medication, because most of these have a lot of interactions. And then the use of unregulated herbal concoctions, that was a very wrong use. And the highlight here is unregulated. Now we even have herbal clinics in the orthodox hospital. So if you want herbal medicine, you don't want orthodox, you can get very expert advice on it. So if you don't seek that, and you tend to use any, buy any herbal medication from any peddler, you are using the medication wrongly. Keeping and using expired medicines at home. So you have medicines, you have some medications at home that was you bought or was prescribed for you about a year ago, and now you're having the similar symptoms. You go for it just because the medication has not changed in taste, color, or even odor. You think, oh, it's fine, and you use it. That is wrong. And then our painkillers, and then finally antibiotics, especially in pediatrics, in children. Most of their infections are viral. What they need is just supportive therapy. But a child is coughing, wants to, then just go and buy antibiotics, amoxiclav and all that. The essence of the antibiotics is to kill bacterial infections. So if you give it to a child who is having a viral infection, it has no place. We are using the medication wrongly. Now, let us look at typical case scenarios where we find ourselves using medications wrongly. So this is John. He's a 65-year-old male. He has chronic pain due to arthritis. Now, a doctor prescribed for him a painkiller for severe pain, oxycodone. And the doctor tells him, take one tablet. Take one tablet every 6 to 8 hours as needed for the pain. So every 6 to 8 hours, like 3 to 4 times in a day. Now, John comes home and feels like, this doctor does not know the kind of pain I'm going through. So I'll take more than he said. 6 times in a day. Now, because he has a valid prescription and it's a chronic pain, when you say chronic, means that he goes to the pharmacy and then he says that, oh, the medication is missing. I mean, the one I bought previously is missing. Just because he's not taking, because he will not say the truth. He will just say that the medication is finished or he has run out, and then he gets a refill for it because he has a valid or for additional pain relief without telling the doctor. Now, look at this typical case scenario. We can glean from it how John is using this medication, that he's taking more than prescribed. You are told, take one tablet or 3 to 4 times in a day. Then he comes and says, I'll do frequent dosing because I'm in so much pain, so I'll do 5 to 6 times a day. So that is wrong. If you have any concern, you are better off telling the doctor so that he will rather, taking things in your own hands. Then secondly, he's obtaining refills from the pharmacy. That's adequate monitoring. And then thirdly, he's using it with paracetamol, which he didn't let the doctor. Okay. So all these things are some of the things that John is doing wrongly. Now, what are the consequences? What happens? Sometimes we will have a whole session on the consequences. But from here, let's just discuss that. So one day the family comes and then they find him unresponsive at home. And then they call, the paramedics, the ambulance come in and all that. They realize that John is having breathing problems. He has a low respiratory rate and his pupil has become very small. So they make a diagnosis that these are classical signs of the painkiller that he was taking, the opioid, the oxycodone. These are classical signs of an overdose of that drug. So now they send him to the hospital and then he needs intensive care. He's now at the ICU. So now John has worsened his illness. Because at first he was just having chronic pain due to arthritis. Now he has ended up at the ICU. Two, he's going to spend more days. It means that he's going to be very less productive if in case he's working or he's schooling. And then thirdly, because he's there, he's going to incur a lot of cost. And so it's going to bring financial burden on him. So we see how when we use our medications wrongly, the repercussions that we will suffer from. Let's look at another case. This one is a woman, Maria. I hope I'm not too fast. Am I?
I am
No,
okay with
please.
No, please.
Okay, great. So this is a 45-year-old woman. She was diagnosed with depression. Okay, so the doctor prescribed for her something to manage the depression. The doctor tells her, take 1 tablet a day, citalopram. Don't worry about the drug. The doctor just tells her to take 1 tablet a day. And then Maria says, okay, she comes home. Then she hears about a certain herbal remedy that is also very good for depression. In fact, very good for depression. Then she says to herself, this is even a more natural way that I can, manage my condition, which is the depression. So, you know what? Let me just do the two together. So she takes both the prescribed drug, the citalopram, and then the herbal supplements, the St. John wort together. So here, what's the wrong use here? The fact that she's mixing the medications together without any guidance. So what happens to her? After about 2 weeks, she starts experiencing all these symptoms: agitation, her blood pressure start going up, confusion, sweating, shivering, and all that. And all these the symptoms that she's suffering from is as a result of the two drugs increasing a certain chemical in the body. And this condition that she's suffering from is very life-threatening. It can end in death. But because Maria did not consult her physician, her doctor, whether she can use both, and on her ignorance part, decided to combine them, she had all these symptoms. So clearly, we see how the wrong use of the medication has ended her out. Now, let's look at some common medications that we misuse, whether we misuse or abuse. Yes. So the first one, painkillers, NSAIDs, especially those who do heavy duty work. They are always in some form of pain because of the posture at work and all that. And they abuse a lot the painkillers. And these painkillers, especially the diclofenac, ibuprofen, the NSAIDs, we call them NSAIDs. These ones, they cause a lot of kidney damage. So now we see the young, middle-aged adults coming in a lot of kidney problems. And you do a background history, and it was because this, for instance, a driver who is doing, drive long distance and all that, has been taking this diclofenac whenever he's in pain for a long time. And because he doesn't know, he ends up with kidney problems. Paracetamol, it causes a lot of liver problems, but people do not know. If you overdose yourself on it, to take it, anyhow, anytime, can get liver problems from it. And then some over-the-counter medications, these cough and cold drugs, you misuse them a lot. Especially, there was this product, can't mention the name, it has this drug in it, dextromethorphan. And this is a drug that, aside its ability to relieve cough, it can also give you these euphoria feelings, hallucinations and all that. And the young guys used to abuse it a lot. Every day they are coming in to buy cough mixture, this very particular one. And you ask yourself, what kind of chronic cough is this person suffering from that is getting this medication almost every week? It's not for the cough. He's abusing it. He's using it for something else, for its euphoria effect. And then the opioids, especially when it comes to the healthcare professionals. The little pain, you just inject yourself morphine. Say, para will not do anything for me. Morphine, tramadol, and all those things. And all these opioids have addictive effects. Then the sedative, the azepam. You can't sleep for one night. Nah, I said, let me just go and get diazepam. And these medications have very, serious side effects. Aside that, people also take them for, delayed ejaculation and all sorts of things. So the intent, they wrongly use this medication, they abuse them. Then the antibiotics, a serious canker because from the pharmacies, because we think that our ailment is an infection. So what is happening now is that because we suffer from simple infections, we're going for the first line antibiotics like amoxicillin, amoxiclav, and all that. By the time we come to the hospital, these first line medications are not working again. So you come with a very simple infection, pneumonia, uncomplicated pneumonia, and the doctor prescribes for you all these medications, the first line antibiotics. It won't work because already you've abused it at home. You've already used it at home. So he prescribes for you this first line. It doesn't work. So he has no option than to give you big antibiotics. Now ask yourself, if you are using big antibiotics, this third line and all those big antibiotics to treat simple infections, what will happen when you get the serious infections? By that time, the big antibiotics will get resistant. So now your serious infection, you have no antibiotic to cure it. So what will happen? Ultimately, you will die. And then the herbal medications, the unregulated ones. Okay, so now why do people use medicines wrongly? Why do people do that? So sometimes it's because of ignorance. It's because of ignorance. They don't know. They don't know that what they are doing is wrong. So they feel based on their condition, based on their pain, instead of the one that they was prescribed, let me take two. But they don't know that maybe because they have hypertension and the diclo that the doctor prescribed, it can also increase your hypertension. That's why you say you should take one. He ends up taking two. But because he doesn't know that it can affect his BPs, that's why he does it. And then poverty. Genuinely, some people don't have money. They don't have money to access healthcare. They don't have money to go to the pharmacy. They even complain that pharmacy is, the medications are too expensive and all that. And so what do? They ask a friend, oh, I'm not feeling well. I have a headache. Do you have some para? Can you lend it to me? They're using it wrongly because you're not supposed to share your medications. They are just for you. And then lack of access to healthcare, especially in the rural areas or places where healthcare facilities are very far-fetched. They have no option. So they will share with their friends, their colleagues, their family, their medications, which is wrong. And then long queues and delays at the hospital, especially our men. They don't like to come and waste time at the hospital at all. They are going to look for money. So they rather just walk into the pharmacy. And even at the pharmacy, to speak to the pharmacist what he's going through, he will not do. He will just say, mommy, Panadol, give me this, give me that. Maybe, but for all you know what you are suffering from, that is not the right drug for you. And then they believe in strong medicine or quick cure. Also leads people to using medications wrongly. The influence from friends, family, media. You sit in the bars, these peddlers come around, and then they speak about one drug that can cure all infections in the world. And you also get it, and you use it. It is wrong. And then you're trusting herbal preparations without regulation. That's what I rightly said. Now we have herbal clinics, registered ones where you can speak to a herbal doctor who can prescribe good herbal preparations for you rather than sitting at home and, taking recommendations from friends and families. Okay, so now, this plenty talking. Why the bother? Why the concern? Why, when we don't use our medications wrongly, what happens? We saw some in the two case scenarios that we discussed. So one, you can get side effects. So lots of side effects, especially when you are taking the medication a higher amount or a higher dose than expected. You can get side effects from it. Interactions, like the metronidazole and the alcohol I spoke about. And then sometimes too, even with food, something like grapefruit juice and all that. It interacts with a lot of drugs. So if you take your medication with some of these juices, you'll be having a lot of interactions. And sometimes even you come to the hospital, they give you an antibiotic, but already at home you are doing your own, daily supplements or even taking some blood tonics. And some of these antibiotics, they interact with these hematinics, the blood tonics, and then the supplements that we take. So if you don't know and you do these combinations together without, you get a lot, and the interactions will produce a lot of side effects, sometimes even death. Then the antibiotic resistance that is also another effect from our wrong organ damage, kidney, liver, even heart. Lots of, when you abuse the medication, whenever you're taking medication, largely most of the medications, is the liver's responsibility to break down this medication. And it's the kidney's responsibility to excrete them, to remove them from our bodies. So if you take a higher dose that the liver cannot bear, you're going to damage your liver. And you take a higher dose, similarly, you are damaging your liver. So using medications wrongly can cause lots of end organ damage. Then addiction, the opioids. We saw on TV recently with the Red and all that. You see how people have abused the medication side that they are so addicted. In a day, they don't get some. It's like heaven will break loose. And then worsening of illness. You saw as in the case of John. So you just have chronic pain. You go and take this medication. It gives you a very adverse reaction, a very big side effect. Now you end up at the ICU. You worsen your illness. Now it's going to prolong your hospital stay. It means that you are going to get a lot of financial problems because you pay. And once you are hospitalized, whether you are working or you are schooling, you become less productive. So it causes academic and then work decline. And then the ultimate, which is death. Okay. So as a family, what are some of the safe practices that we can engage in to ensure that we are using our medications rightly? Number one, be informed. Ask questions. Always ask questions. I know that this thing is a very big problem. People come to the hospital and I don't know whether we are scared or so they also prescribe the medications for you, and that is it. You also just come to a pharmacy, we sell it for you. You don't ask questions, nothing. And you go home and you just take it like that. It is wrong. Your health is in your hands, so you have to be part of the decision. So ask questions. Why am I taking this medication? How am I going to take it? Ideally, the healthcare professional is supposed to give you all this information, but sometimes because of the workload, there are lots of people in the queue and all that. So you want to just hurry up and then. So once you ask, then it brings out all these information. And then follow directions. Take the medication as is prescribed. Don't go and then, add your own thing to it. And then read the label. Now, we are fortunate to have a lot of drug leaflets in most of the medications that we buy. So read it. Some of them, yes, you might not understand. If you don't understand, you can always Google for simple language, or you can speak to, a pharmacist friend, a doctor friend, or even your own physician, a family doctor. Now, I read this on the label, the medication that you prescribe for. It says this, and then I'm also having all these things. Should I stop? Should I continue? And all that. And then do not share your medication. The medication is just for you and you only. The fact that your sister, your brother is also having it, that having similar symptoms, doesn't mean that you're suffering from the same condition. So don't share. And sometimes some of the relatives are they react to certain medications. Some react to drugs that contain sulfur and all those things. So if you don't know and you share, you put your sister in trouble. And then storing our medications safely. We should store our medications well. That's safe practices. Don't come home and transfer it into another container and all that. It causes a lot of contamination. And then we should keep it away from our children, obviously. And then lastly, we should dispose of the expired medications well. If you do not know how to dispose it, just bring it back to the pharmacy. We keep them and then FDA will come for it to go and dispose it off. So in conclusion, I would say that medication misuse or wrong use of medicine is a serious problem, but it is preventable. Yes, so let's all be informed. Let's follow instructions. Let's communicate, ask questions. Our health is in our hands, so let's be safe. So a few references for further reading. Thank you very much. Any questions?
Thank you. God bless you so much.
Amen. Yes, please,
Please,
you
I have
can
a
go
question.
ahead. Yes.
So thank you. In fact, thank you very much for this presentation. It is very insightful. I want to find out, especially for we the ladies. I think that I got a big scare when you mentioned that even paracetamol, because more often than not, we believe that it is like the lowest of all the drugs, like, oh, para, they say, yes. So if like for a lady who maybe I have cramps monthly and I tend to fall on medication and that low is not is like too high. So okay, I'll fall on paracetamol every month. And how about that? Is it advisable? Yes.
Okay. So first of all, you have to know that every drug is a chemical component. Every drug is a poison. It's just the dose, how much you take it, that differentiates its efficacy from its bad effect or side effect. So yes, paracetamol, you might think that paracetamol or is the least of all the painkillers, it won't do anything. It's the amount that you are taking that will differentiate its harmful effect from its good effect. So if you are doing it every month, you are taking it, ideally, you're not supposed to take more than 8 grams. That is like, if you are doing 500 milligram, more than 8 tablets a day. So if you end up taking more than that a day, then you're going to get the liver damage. Please, do you understand? So yes, it's the safest and all that. It's the dose that you are taking that will differentiate its safeness or its effectiveness. Please, are you clear? So if every month you are taking it for your menstrual cramps and all that, mind you, how much are you taking for that? If you continue to take it for a very, very long time, you will definitely get some of these effects from it. Thank you.
Thank you. Thank you.
Hello.
Please, you can, yes, unmute and talk. Yes.
Thank you. I think you mentioned something about the disposal of drugs, and you mentioned that if you're not sure how to dispose, you should take it to the pharmacy, and then FDA comes to take it. I didn't know you had to go through all of that. So what's wrong with just throwing it in the dustbin or something like that?
Wait, so most of the medications, see, when it expires like that, they become poisonous, more poisonous, if I should put it that way. Now you put it in the dustbin, they come for it, they go to the incinerator, then they also dump it into the water bodies. Then, the cattle will go and drink it our own, we fish from the sea and all that. We go and cut them, then it comes back to our table and then we eat them. So it's like a cycle that we are doing because he didn't dispose of the medication well. Please, you understand?
Yes,
Hello.
please. Yes, please.
Yes.
Thank you.
Yes. So we have to always dispose it of rightly.
So
if you don't
what
know
then
how
will
to go
be?
about it.
Yes, assuming maybe you don't take it back to the pharmacy and you want to do it rightly, what would that?
So
Maybe
so
you said it earlier.
ideally, Ideally, you're supposed to unpack it and then just, set it ablaze. Just bend them. That is what you ideally do. But if you cannot do that, just take them to the pharmacy. We'll discard them for you.
Yes.
Hello.
Yes, thank you.
Okay, please, I have a question.
Yes.
My question is that you have a friend, a prescriber,
Yes.
who knows your condition, or you are suffering from something he knows of. Not precisely, he has checked your system before, know your system very well. But being a friend, a prescriber, you told a friend that you have this channel and the person prescribed a medication for you. Please, what about that situation?
So it's always good. I understand you, and that's what we mostly find ourselves in. You just call a friend, a pharmacist, say, I'm having these symptoms, and then the person prescribes for you. Ideally, you're supposed to seek like expert advice on the medication. So you're supposed to go for a comprehensive assessment, because what you are thinking might be wrong with you might not be necessarily what is wrong with you. So you might just call your friend and say, I'm having fever, I'm having pain, I'm having chills, right? But say, oh, that's malaria. Okay, go and get your Lunat or your Lufat and take. But ideally, in some circumstances, it might not be malaria. Yes, in some circumstances, it might be malaria. You take it and then you are fine. But sometimes it might not be that. It might be something else. So if your prescriber friend gives you that, ideally that is wrong. If you have to go strictly, you're supposed to go for a comprehensive assessment for us to, do all the labs and everything, then diagnose you and give you the proper thing. Or if he can also do all the proper assessment, fine.
The other way. Thank you.
Yes. We find ourselves doing that a lot. Even me as a pharmacist and all that, I'm always doing that, but it is wrong.
Hello, Doc. Thank you. Thank you so much for the insightful presentation. In fact, I personally wanted to give you a call to explain my situation to you so that you can prescribe something to me. But your last let me hold my peace. But anyway, I don't know whether it's a general notion or it is just me who have come into contact with that information. There are certain brands of drugs or medications that are more potent than others. Maybe some people believe that drugs from the UK or companies in the UK are more potent because maybe the active ingredients in it are higher or something compared to what is produced by companies in Ghana or maybe India. How true is this assertion?
Okay, this one is a legal issue. You will get me in trouble. Anyway, so it is true. Okay, it is true. The active ingredient, let's take for instance, paracetamol is a powder, but we have various grade of the powder. Okay, we have grade A of the powder of paracetamol, which is very potent. We have grade B, it is midway, and then grade C. So now, if the medication is coming from the original innovative drug, paracetamol, before the other companies, copied to make a similar brand of it. If it's coming from the innovative, it is a grade A powder of the paracetamol that the person used. And so if you take even just a dose, you are going to get, the now if you buy another brand of it that was made in maybe, let's say, Ghana or India or something, or another country, the drug out of maybe a grade C powder of the paracetamol, obviously you will see the difference in the efficacy of the drug. And it's just use. Please, you understand. So yes, sometimes some prescribers prefer a certain brand for their patients. If it is Pfizer, they don't want any other brand because of some of these little differences that causes, little differences in the efficacy of the drug.
Very well.
Please, you understand?
Yes, I do understand. Okay, so let me hold it here because you mentioned earlier that this is a legal issue or something. So yes, I'll hold it here. Thank you.
Okay, right. Please, you
Yeah,
can
hello.
unmute and talk. Yes, please.
Yeah, thank you so much once again. And
Yeah.
so my question is, I think you spoke earlier about maybe abuse or maybe using overdose. So I want to
Mm,
find out, we have certain supplements like the vitamin C's and the folic acids and
mm,
calcium and things.
mm,
Sometimes people are just taking a lot. So I want to
mm.
find out those ones too. Would we say that we are abusing them? Sometimes even our kids, I want to let them take vitamin C like every day or
Yeah,
take something. Is it also an
yeah,
abuse?
yeah, yeah. So, um, let me give a scenario. So, I was not feeling well this weekend. I went to buy vitamin C. Wrongly, I also used my own. I self-medicate, use my own instincts, and I went to get a vitamin C and paracetamol. But she was not well, so I decided to take her to the hospital. And the doctor prescribed the same thing, paracetamol syrup and vitamin C. And I was asking myself, but that's the same thing I also did. And she was telling me that I should give it to her every day. So here is the difference. Now, under the guidance of a healthcare professional, she is telling me that I should give the vitamin C every day, especially because she has started school. So now it's no longer a misuse. I'm no longer misusing it because originally the intent was that I was also going to give it to her every day because she has started school. But now that the healthcare professional says I should give it every day. I'm following instructions. So now I'm going to give it every day. So the vitamin C that you are talking about, if it's on your own guidance, you are misusing it. But if it's under, the guidance of a healthcare professional, a physician, then that is fine. You are using it rightly. Okay.
Hmm. Thank you so much, um, Doc. I want to ask a few questions.
Okay.
Number one, what guide is there any guidance that maybe a school or maybe you are home, you have a first aid box? Is there anything you need to go by to be able to use the first aid box? Because you have taught us about going by a health professional's instructions and all of those things. So, do you need to go by any form of guidance to use the first aid box? Or do schools or institutions need certain training to be able to administer first aid? Because there have been speculations about certain schools giving children cough syrup. If the child is very high power, they want the child to just sleep, they'll give the child cough syrup so that the child will sleep so that they can do other things. So it's a
Okay.
concern. I just want to ask, what
Okay.
is in cough syrup? Is it safe that way?
Okay.
Number two, what guidelines are schools or institutions supposed to go through to be able to administer first aid? And if yes, like please, if you have any explanations to that before I.
Okay. Okay, thank you. So, Nancy, as you rightly said, it's a cough syrup. It's not supposed to be for sedation. It's supposed to relieve cough. So, if your intent now is to give it, to sedate, to make the children calm or sleep, you are misusing it. You are actually abusing it. Now, secondly, these institutions, we are supposed to have a health assistant or a health aide, someone, a trained professional to dispense some of these first aid medications. So this trained professional has the right to, give some of this or serve some of these first aid medications. So if you don't have the presence of this trained healthcare assistants there, and the teachers or the, caretakers are the ones giving the first aid, then that is wrong. Please, have I answered your question?
Yes, please. You've answered it. So in schools where the first aid box is just in the headmistress's office, when
It
the
is wrong.
child is okay, it's
It
from
is
what
wrong.
about the house?
Institution. Yes. So in the house, for you to get the first aid box, you have to get it from a pharmacy. The pharmacist must check all the medications that you are putting in your first aid box. So it has to be under the guidance of the pharmacist in procuring your first aid box. So once you get it from the pharmacist and he instructs you, maybe your child is having fever and he puts in paracetamol syrup in there, he tells you how to give it based on the age or your weight, the weight of the child. You'll be instructed on how to do it. So if you follow it in emergency cases and you give it, that is right.
Okay, please, the last one. In
Okay.
terms of herbal medicine, you
Yeah.
gave some case studies on how the lady took the herbal medicine. So is it right to finish taking the doctor's prescribed drugs first
Mm.
on medicine, or how are you supposed to go about it?
Yes. So herbal medicines are good. In fact, especially the regulated ones. I mean, that's what our forefathers have used. So they are good. Once it's been certified, registered, or regulated, it's good. But the thing is that most of them interact with the orthodox drugs that we know of. So always tell your doctor. So the doctor has given you a prescription for a drug for your condition, and you know that you have some, herbal medication at home that you usually take. Just tell him, oh doc, I also have this herbal preparation that I take. Can I take it together, or should I finish the orthodox medication and then continue with the herbal one? This one, the orthodox is fine. Or, I mean, that herbal medicine you have is also equally good. So you just finish the orthodox one and then you can continue with your herbal preparation. So always ask the doctor, let the doctor know what herbal preparation you have. Then he can tell you based on his expertise, the knowledge, whether to take it after or not to do it at all.
Okay, thank you.
All right, Doc, thank you so much for the enlightenment. I have some few questions. So I seek your indulgence to ask these questions.
Yes,
The
please.
first one has got to do with those of us who are on some medications that we are expected to be on as long as we live.
Right.
Some are on hypertension medicine, diabetic medicines, and other
Mm.
medicines. I
Yeah.
know almost every medicine comes with its side effects,
Right.
and as a result, some people are not so religious with these medications. What
True.
advice do you give to people in that category? The second thing
Okay.
is also, you have read that this medicine you are on, this is the long-term effect. How do we also manage it? Are there other ways to manage these long-term effects? So it should be when you are almost close to your grave and I have done the early stages of old age, or you respond as and when I continue.
Okay. So the very first one with the using being on some lifelong medications, and then you reading about their side effects, what's in those who are not really religiously following the advice that I'll give. So what I would say is that what how should I put it? You not religiously abiding by or adhering to the medications. Okay, maybe for instance, hypertension. If you don't take your antihypertensive drug religiously and your blood pressures would keep rising, that can kill you faster than abiding by it and getting some side effects. So the advice I'll give is that yes, it's difficult because swallowing pills is difficult, and I mean with the mindset that you're going to do it for life, it's not easy. But you have to try, because if you don't do it, even the complications like stroke and all that will set in, you don't want to, go through it. So religiously try. Some of, especially the antihypertensives, some people will be on 2, 3 different medications just to manage the hypertension. If you feel that the 2, 3 is too much, so you cannot religiously, take 3 different medications for just hypertension, talk to the doctor. Now we have brands that have merged this antihypertensive, I mean, like 3 different drugs into one tablet. So instead of taking 3 separate pills for just the hypertension, you can easily just take one, but it contains all the 3 medications in there. So there are so many ways you can go about it. I mean, so that you can religiously abide and then take your medications. If not, I mean, the complications, they are more severe. So that's what I would say for the first one. And then the
All right.
second one,
Thank you.
yes, the second
Sorry.
one, you said you read about the side effects, and then you know that if you're going to take this for lifelong, you're going to, suffer from these side effects and all that. Are you waiting till you get to the end of your grave before? So, because the fact that every medication has side effects does not mean that everybody will have that side effect. That's something we have to know. Drugs. Most of them cause a lot of headache. Hypertension in itself gives headache, but some of the drugs also, add to it. It. So if you're in the category where you are experiencing the side effect, or you've read that at the long run is going to give you kidney damage and all that, that is why we read about that the medication cause. Let them run the labs, check your, kidney function test, your liver function test. They will be able to tell if it is, and then they will make a search for you. Please understand. But if you've read it, but you are not suffering from it, you are not being on it, you go for your reviews, they do all these labs for you, and they say that still. So, I mean, periodic reviews is very essential so that you are always, on edge, you are top on your health issues. You know that although this drug causes this, the last 3 months you went for a review and your kidneys were fine. So you are good to go. Please, is it clear?
Yes, please. The next question: when you watch commercials of medications, you hear statements like, if symptoms persist for 48 hours, consult your doctor.
Yeah.
Is this to encourage self-medication, or the rationale is that having gone to the hospital and you have been given these medications and you are on it, and within 48 hours you are not responding, you go back? I've had instances where I have gone to the hospital, I've been given medications, and maybe after some few days, I'm not seeing progress. The medicine is not finished though, and the doctor will no examination, nothing, and it's like, go and finish the medication and come back, and those things. Now, those commercials, is it to say that we are to self-medicate? And very often these commercials are done for pain reliefs, medications. Is it to say that we can take these medications and beyond 70 2 hours or 48 hours. If we are not responding, then we go. Is that what those commercials mean? I just want you to clarify some of these things for us, so we will be guided as we go into the future. Yes.
Okay. All right. So one thing you have to know is that every drug and its time of action, the time that you see its effects, every drug, it differs from every drug. Most of the painkillers, 24 hours, 48 hours, you should see effect from it. The antibiotics, they take much days, 72 hours, 120 hours, that's like 5 days and all that. So it depends on the drug and its time of effect. So most of these commercials that they do for the pain relievers and all that, what they are trying to tell you is that when the doctor prescribes it for you and after 48 hours you are not seeing any effect, it means that the medication is not working. So go for a review, go for a reassessment, and let them change the medication for you. And then in the cases where you go to the doctor has prescribed a drug for you and it tells you after you've come home, you've taken it, you are not seeing any effect, you go back and it tells you to continue. It's because the doctor knows that it takes a longer time to see an effect from the drug. And so he will tell you, you go and then complete the full course. Especially with the antibiotics, go and complete the full course. So if you go and then you complete the 5 days, 7 days, and still you are not, then when you come, he will change it for you. Because if you should start you an antibiotic, you take it for 48 hours, just 2 days, and then you come back and say, no, I'm not seeing any effects from all that. He knows that the drug takes time to act, what we commonly call the half-life of the drug, and all that. It takes time for the drug to, act. So you definitely refer you that go and complete it. If you complete it, the 5-7 days, and then you are not having the relief from the drug, then I'll change it for you. So it's not to encourage, self-medications from the commercials. No, it's just because the time that the drug takes to act has elapsed for you to see an effect has elapsed. So go for a reassessment. That is it.
All right. Thank you. So my last one is counsel to all of us. The first one I want to talk about is, please, when we go to the hospitals and we are given medications, let's not be in a hurry to take it. Fortunately, it's an enlightened community, and I will encourage each and every one of us. Let's take the pain to read, be it our children, be it ourselves. That few minutes or few seconds you administer the medication for yourself or for your wards is very critical. We have personally had several instances where medications have been given to our children. We come home, we read it, and we notice that it is not speaking to it. We go back to the hospital and it has been swapped. So maybe the person before us or after us, our medications have been given to them and theirs to us. And at times my worry is if the other person had even taken it already, and it's rather going to complicate issues, then they're in a mess. So please, as much as possible, once the medication is given to us, even if the manufacturer's writings are not in, today all you have to do is to consult any of the AI tools, and I know you can get some adequate information on these medications. So as much as possible, let's take pain to read. It will go a long way to help us. So please, it's very important. The next admonishment I also want to give is the fact that, yes, we know medical care is very expensive in Ghana. And for some of us, at times, we want to go on the quick route. At times, cheap things can be more expensive. If you don't have the means to access the expensive medical care, the NHIS is still working. You get it. At least use that for the consultation, and then look for the money to buy the medications. It is working. People are using it. So please, let's not rule it out entirely that it is as if it is entirely bad. It's very important. Our health is paramount. if we will live long on this earth and God decides to bless us with long life, the container must have the strength to carry the spirit and the body so we can be effective at what we are doing. So thank you all so much for joining the call. And Doc, thank you so much for the time. Colleagues, Doc is just a call away. Fortunately, in our community, we have a lot of people within the medical field. We have the nurses, we have the doctors, we have the pharmacists, and many other people. Please, as much as possible, when in doubt, reach out to these brethren, reach out to these friends, these colleagues of ours, and let them lead you as you seek medical support. God bless you all. Thank you. So over to you, MC.
All right. Thank you, Reverend, for the advice. And thank you, Mrs. Dapo, for such an educative session. It's our prayer that God will grant